My first question is, why Barrie? This is very important day nationally across Canada, and there are bigger cities with so-called bigger problems with bigger population. So why did you choose Barrie, a very small city?
So, first of all, to be clear, yes, this is happening across Canada, but it's close to home. I'm an Ontario MP, but I'm also a federal minister, and Barrie is having higher numbers than many other centres across Ontario. They're amongst one of the higher impacted areas, and it's to let Canadians know that this is happening across the country in cities big and small, in rural and urban centres. And Barrie is close to home for so many in this part of Ontario, and we want to just raise awareness that it impacts all communities across the country.
So your speech is very different from what we hear in Barrie. From the council, from the mayor, the approach is very different. There is opposition to the safe consumption side, which has been, with the provincial government for, too long. So what is your idea behind, how to address the opioid crisis and the drug poisoning crisis?
So I think first and foremost, at the federal level, it is our role to look for every opportunity to partner, to collaborate, to work with those who are working on the ground to save lives every single day. It's our approach to work with everyone and to look at evidence-based best practice approaches. There are 4 key principles to addressing a toxic drug supply, whether it's in Canada or anywhere around the world. It starts with harm reduction, it starts with prevention, it includes treatment, and it includes enforcement. And we are going to stand by those principles, but also work with incredible organizations like Mom Stop the Harm, like Ryan's Hope, to make sure that we're bringing everyone to the table so that we're saving lives.
So any in particular policies, working with the cities, working with the provincial government, in terms of getting, maybe the safe consumption side, which has been waiting for too long, or just the bylaws, a couple of months ago that city tried to pass, making it, trying to make it illegal for offering help on public land. So in terms of those policy coming from the from the city and the provincial government, and what federal government can do to stop those harmful policies, or provide better help for the residents.
As you well know, healthcare is in the purview of provincial jurisdiction. At the federal level, it's our goal, and it is our role, frankly, to continue to work with provincial and municipal partners to bring the best evidence to the table, to bring the best practices. We have every resource and tool available to us to work together to save lives. And I will continue to keep talking to my provincial and municipal counterparts to ensure that we are bringing every tool we have to every community that wants to continue to work with us, talk with us, collaborate, partner with us to save lives. And that's really our primary goal at the federal level, and we have to be relentless in offering that collaboration, and also relentless in offering the tools and compassion and every resource needed to make sure that we are in alignment in saving lives.
Yeah, so the last question in terms of message, what message you have for the Barrie Mayor Alex Nuttall, his council, or the provincial government when it comes to harm reduction, opioid crisis, homelessness crisis, what advice you would give to them?
So it's very simple. Addressing the toxic drug crisis and saving lives is not a partisan issue. This is a goal of improving healthcare and healthcare access to every member of our communities, whether they are struggling with mental health or whether they are addressing substance use. We all want to come to the table in a way that helps to save lives, to help those who need our help, and making sure that the resources that they need, the services that they need, are available and accessible to them. And that's where we're coming from. This is not about politics, this is about people. And we will continue to work with our provincial and municipal counterparts to make sure that we hear each other and see those who are struggling so that we can save lives.
So just to make it clear, so in terms of you are saying the federal government is there to offer all the help if the city or the provincial government need to address the opioid crisis, the drug poisoning crisis, and now it's up to them to reach out and get that help.
We will always work collaboratively with our counterparts to ensure that there is access to the healthcare and to the supports and resources that communities need in addressing their toxic drug supply.
Okay, thank you so much.